Okay, I have with me Dr. Logan. Sorry, I'm going to butcher it again. Spacek. Okay. Logan's going to be doing our class next month in February on the 26th. Logan, would you like to introduce yourself? Tell us a little bit about you.
Sure. Yeah. So I met Kaela through kind of some mutual postpartum experiences and similar interests as far as wanting to help all the mamas as much as possible with prevention of postpartum anxiety and depression, and then also giving them those resources so they can feel better quicker. And so I am a doctor of physical therapy, but then I also am a holistic pelvic physical therapist, and then I also do postpartum wellness coaching. So I had two very rough postpartum experiences that really shaped kind of my career and what I decided to go into for just my professional career, and started my business, Reclaim Wellness and Postpartum Support, a couple of years ago, and have just kind of been helping moms through programs, holistic wellness programs, to help them feel better and also prevent postpartum anxiety and depression. So,
I love that. Awesome. And you said that you had your own personal, difficult postpartum experiences. Did you want to elaborate any on that?
Yeah, I mean, gosh, there's quite the story. So I'll try to give a little bit of a short version. My first pregnancy actually started out with a miscarriage. So that was very traumatic, actually, because it happened at my husband's grandparents' house on Thanksgiving Day. So I was really early. I was only about 8 weeks, but just, really excited about the pregnancy and just kind of in denial about what was happening whenever I started to have the miscarriage. And so that was kind of my first trauma. And then during my pregnancy with my daughter, I got pregnant pretty quickly after that first pregnancy, and just had a really tough pregnancy, had a lot of issues during my pregnancy, back pain, major, I know now, probably anxiety even during my pregnancy, but I didn't really pick up on it then. And then just planned for a natural birth, and it didn't go as planned, unfortunately, because I ended up having preeclampsia. So I was actually induced at 41.2 with her, and delivered her. And then my postpartum was pretty much a crazy nightmare, to be totally honest. Pretty much anything that could have gone wrong went wrong. I had major insomnia issues. I had major breastfeeding issues. I had a lot of perineal pain. I had pelvic floor issues, difficulty emptying my bladder. Most likely some bipolar and or anxiety. It wasn't really depression. It was more on the other side. And then unfortunately, whenever I was seeking out resources to try and get help, they were very lacking and they were very inappropriate for what I was needing, right? And the medication, of course, was really the only option they gave me, besides sending me to an inpatient psychiatric hospital, which I was not, I was breastfeeding, so I wasn't going to go to an inpatient psychiatric hospital, Medication actually made my symptoms worse, so I did start having suicidal thoughts at that point, and so I took myself off the medication because that's not me, and I did recognize that, and then I got pregnant pretty quickly with my second. And he was a surprise baby, and his postpartum went a little bit better, but I did still have some issues, including family issues. I had a lot of issues with my husband and with my mom during both postpartum periods. And I actually had an IUD placed at that time, and I had a lot of issues that stemmed actually from the IUD. And so I only had it in for about 4 months. And then once I started weaning and I got my period back, that is whenever I started to feel a lot more like myself. So, at that point I had been pregnant or nursing for about 4 years, at that point. And I had never had a period, so it just really got me thinking, because I am more on the holistic side, just really thinking about the menstrual cycle and that hormonal connection that we have as women. and how that's so important. So that's when I kind of started writing my books. So
awesome.
Yeah.
Wonderful. So you will be teaching our class in February on the 26th. Can you tell us a little bit about what that's going to be on?
Yeah, I am most likely going to be doing kind of definitely stuff on postpartum preparation. So all the things for those pregnant mamas going into postpartum, kind of like a mini prep course similar to what I teach, in my books and in my class. But I just want it to be pretty well-rounded with some very actionable steps that these pregnant moms can take. And then also those moms that are postpartum, being able to recognize, like, if you are having symptoms of a perinatal mood and anxiety disorder, that you can become more aware of that and know where to seek help for it. And then also some ways, some holistic wellness techniques to help you feel better quicker without necessarily the use of medication. So
awesome. Wonderful. Well, we are so excited to have you, and we can't wait to, sit through that class and see what all it's about. Thank you so much for coming on here and giving us a little introduction. And so for anybody who's interested, the link to sign up for this class will be in this post. We look forward to having everyone here.
Yes, and thank you so much for having me, Kaela. I know you're such a really valuable asset to all the mamas, and I just think that what y'all are doing at Sitting Moon is so great. So I'm excited.
Our mission at the Sitting Moon is to raise awareness, remove stigmas, and reduce barriers, thereby contributing to a healthier mother, family, and society. Please, if you're having any problems, we encourage you to speak up, get help. Remember, you are not alone.